talk about using the Grid SDK. This is going to be the Grid X, so this might look a little different than the one you have at home. The one you might have is the orange one. This is the black one. A little bit more dense on the pads. The foam is definitely a little bit harder on this one. I like it just because of the way I typically use it. I don't generate a lot of force with this, but typically using it to really stimulate a good vibration technique or a good vibration sensation through the muscles that you're working on. All right, so everything else stays the same. You got the same acupressure grip, so we can use that a couple different ways. We're not going to look at that or focus on that for today's video. So what we're looking at here today is working on the calf. I'll do it really quickly here in the half kneeling position. Of course, you can do this seated in a chair. You can do this on a Swiss ball if you really want to stress your balance while you're working on this, or you can just be sitting on the ground. All right, so we're going to have the knee bent. All right, we're going to divide the calf up, or the lower leg up, into two zones: top zone, and a low zone. All right, and again, right here in this position. All right, and some of it tells about putting a little bit of pressure in through here. Some of the other videos that you might see, I like very light pressure. So light pressure and speed. All right, light pressure and speed. I do about 4 to 6 strokes straight up and down, then a little bit out to the side. Grab those peroneals, the muscles on the outside of the lower leg, back to the inside, and then come over and catch the inside. Really working through that medial aspect. All right, see a lot of issues between soleus and the medial aspect, or the inside aspect of that tibia. We tend to see a lot of issues going on. Soleus trigger point causes what looks like a lot of heel pain. Same thing with the long flexors of the toes, including the toes as well as the big toe. And then you also have posterior tibialis muscle, which is up in the higher zone. So about six strokes straight behind, 6 strokes to the outside, 6 strokes to the inside. We'll move up to the top zone. Same thing. Now we're working right over the bigger muscle, meatier muscle, the gastroc. Same thing. Get to the outside. We can get that lateral head of the gastroc. A little bit further out, we can get that peroneal. Shouldn't be any numbness, tingling, or any kind of other funkiness. If you notice that, paying us or take some pressure off. Getting back over to the inside. Again, getting that medial head of that gastroc, as well as getting over and working right along the inside of that bone. Now, additional technique that we can throw down right there. So if we've got some point tenderness right in that area, we can put our hand so off the AccuGrips, put our hand onto the actual roller itself. All right, this we're going to put a little bit of pressure through. So I'm going to hold that just so I can take up some of the skin, and I'm going to slowly slide on down. Very, very slow, very, very slow. Sliding on down, sliding on down. Easy myofascial technique, myofascial release technique right here. And for this, I'm going to start proximal and work distal. Okay, so starting close to the knee and then working down toward the ankle. Take it off of the leg and back in. Same thing, putting pressure on and working straight down the inside. If you feel like you find a spot that really needs some concentrated work into that inside of that calf, you can go back to the lacrosse ball, or we can use the acupressure part of the handle here. And same thing, we can just stabilize the stick and then put some ischemic pressure right into that spot. Now that's a lot of different techniques that you can use the STK, trigger point STK, on in and around the lower leg. All right, you can use that myofascial technique anywhere. So if you want to be out here on the outside, again, hands are on the roller itself, keeping that from spinning. This is Oreo, my puppy dog. All right, then working straight down. We can do it on that side, straight to the back. We've got the standard stick technique. Again, sort of best practices on this. Split the leg up into quadrants. Work on so cut it in half, work on the distal part, then work on the proximal part, work on the outer part, work on the inner part. Cool? All right, hope that helps you guys out. If you got any questions, definitely hit us up. Again, Paul Koloski, Vallejo Physical Therapy, Vallejo PT Online, and we'll see you in the next video. Have a great one.